Healthcare costs in North Carolina are about to take a dramatic turn, especially for the million residents who depend on the Affordable Care Act, ACA, for coverage. Imagine this. Next year, your monthly premium could jump by hundreds of dollars, and there's no silver lining to cushion the blow. But here's where it gets controversial. The federal subsidies that have kept ACA plans affordable for many are set to vanish in December, adding insult to injury. Let's unpack why this one-two punch is sending shockwaves through the state. Leading insurers offering ACA plans in North Carolina are requesting staggering rate hikes for 2026. Amerihealth Caritas is leading the pack with a 36% increase, while UnitedHealthcare of NC is asking for 32%. Blue Cross Blue Shield and Cigna aren't far behind, seeking 29% and 27% hikes, respectively. These proposals are now under scrutiny by State Insurance Commissioner Mike Causey, though he can't unilaterally reject them. Federal regulators hold the final say, but Causey does have the power to deny requests deemed unjustified, unreasonable, or discriminatory. The last time this happened, back in 2010, when Blue Cross Blue Shield's rate increase was rejected and forced to renegotiate. So what does this mean for everyday North Carolinians? For a healthy 21-year-old, the average monthly premium could soar from $486 to over $710. Older adults, already paying $800 to $1,200 a month, might face bills nearing $1,400. But here's the twist. The end of subsidies, set to expire in December, adds another $58 to the average enrollee's monthly tab. Combine that with the insurer hikes, and costs could skyrocket faster than many can prepare for. And this is the part most people miss, the ripple effect of younger, healthier people dropping coverage. Hollis Smith of the NC Navigator Consortium warns that if young adults abandon ACA plans due to high prices, the risk pool becomes skewed. Insurers, facing a sicker, older customer base, raise rates preemptively. It's a self-feeding cycle. Fewer healthy enrollees equals higher premiums equals even more people dropping out. Smith calls it a tough choice for individuals, but critics argue it's a systemic failure of ACA's design. Blue Cross NC has publicly acknowledged the affordability crisis, stating they've sounded the alarm on the issue. Meanwhile, UnitedHealthcare of NC hasn't responded to questions about their massive rate request. With open enrollment for 2026 starting in November, the pressure is on for policymakers and insurers to find a solution. But what if the real problem isn't the rates themselves, but the people who pay them? Will this cycle of rising costs and dropping coverage continue to spiral out of control, or is there a smarter way to stabilize the system? Share your thoughts in the comments. Do you think the ACA structure is to blame, or is this simply the cost of living in an increasingly expensive healthcare landscape?